survivor. Been doing it for about 19 years now.
Co-production, making it a must-do.
I want to go someone who has been through what I've been through. Either to sit beside me and go to the housing office, so the buddy scheme or advocate within social care.
The sort of transformation of services into what sounds like could potentially be a more co-productive, better communicating, interactive service with the actual communities.
Our work at NSUN, under the auspices of the National Involvement Partnership, has been to develop these standards based on our history in developing standards that very much come from our roots.
If I have seen further, it is by standing on the shoulders of giants. Isaac Newton. In 1845, John Thomas Percival, a British Army officer confined in asylums for 3 years, spent the rest of his life campaigning for better treatment and founded the alleged Lunatics' Friend Society. In 1973, the idea of a mental patients union was born. The fish pamphlet, picturing a fish struggling on a hook, was used to fight against oppression. ECT, lobotomies, medical and physical restraint. A federation of mental patients unions was formed in 1974. Survivors Speak Out was founded in 1986 by a group of mental health service users and workers. The term survivor was chosen to portray a positive image of people in distress and people whose experience differs from or who dissent from society's norms. People First, a self-advocacy organisation, was established in 1987. Then came the first World Mental Health Day in 1992. By 1999, a mass movement. Mad Pride activists seek to reclaim their power. They reclaim terms like mad, nutter and psycho. The recommendations of a report called On Our Own Terms, authored by Jan Walcroft with Jim Reed and Angela Sweeney, included the establishment of an independent network in the UK. And so, in 2007, NSUN was formed. NSUN exists to facilitate active links between service user groups and individuals. The vision is to bring people who access services and the survivors and carers together to communicate, feel supported, and have the power and the platform from which to have direct influence at every level.
So what are they?
Principles, purpose, presence, process, impact.
4PI.
What we want to do with the 4PI framework is to sort of hardwire this kind of notion of involvement into services so that there is a framework to hang it on, to make it sort of more robust and hang in there for longer, not just be sort of discarded with the next restructuring of the Department of Health and Services. We want to see it stay.
It's all about strengthening the ability of service users and carers to get their voice heard.
The key point is respect and equality in working relationships. The service user and carer are on the same level as staff, otherwise it doesn't work. Meaningful and inclusive involvement starts with a commitment to shared principles and values. The purpose of involvement needs to be clearly stated and agreed at the very beginning. Everyone connected with the involvement activity knows why people are being involved. Clarity of purpose, transparency, and the intended outcomes should be agreed from the beginning.
We all support each other, you know, everybody that knows everybody kind of supports each other.
Presence. Service users and carers need to be involved at all levels. At the individual, community, operational, strategic, monitoring and evaluation. There needs to be a diversity of service users and carers involved. Process. We need to be involved at the very beginning with the development rather than just delivery. Process needs to be carefully planned and thought through to ensure that service users and carers can make the best possible contribution. Information should be made widely available through a number of channels. This may mean adopting non-traditional approaches, such as outreach, working with mediators, and working in diverse communities. Flexibility must be built into the process to enable people to take advantage of different opportunities. There needs to be sensitivity to language, and meetings should take account of those involved and consider reasonable adjustments. Decision-making processes need to be open and accessible and collaborative. There needs to be support, peer mentoring and training. The ultimate goal is to improve lives, inclusivity, equality of opportunity and fairness, a commitment to change.
With involvement, don't sort of stop when you feel it hasn't worked the first time. I think that was an important message, that learning from experience in terms of involving people is really important, because it can actually, build for much better involvement the next time round.